and I appreciate the gentleman's efforts in this regard. I would like to take a few moments and clear up some of the mischaracterizations that have occurred, unfortunately, around the debate of this bill as it's worked its way through both houses. There have been some that have claimed that my side, the Republicans, do not support providing treatment for 9/11 first responders, and that these first responders are currently going without treatment for the illnesses and injuries they suffered as a result of serving at the World Trade Center. Both of those claims are simply not true. According to President Obama's administration's own Center for Disease Control, the agency said, and I quote, "We'll continue to provide monitoring and treatment services for mental and physical health conditions related to World Trade Center exposures for both responders and for eligible non-responders. The World Trade Center program is critical in meeting the ongoing and long-term specialty needs of individuals that were exposed to dust, smoke, debris, and psychological trauma from the World Trade Center attacks." Close quote. As of September 30, 2009, the World Trade Center program had enrolled over 55,000 responders in its monitoring and treatment programs. This is the Centers for Disease Control's budget this is in the CDC's budget justification for 2011. As the Energy and Commerce Committee's mark of this legislation, Republicans offered an amendment that would authorize the program that is already providing treatment and monitoring benefits and authorize funding for the program at exactly the level that was requested by the President of the United States. That same amendment asked for real accountability to ensure that we knew how the tax dollars were being spent. Unfortunately, that amendment was defeated. Now, I am pleased that work in the Senate has yielded an amendment that will provide for increased accountability, increased transparency in how these funds are spent. H.R. 847 caps the number of people that can be enrolled in the program, but it does not require those enrolled to verify their citizenship. We offered an amendment that would require this program so that people in the country without benefit of Social Security numbers would not get benefits while Americans were being stuck on the waiting list. This amendment was defeated. As with any government spending program, there should be limitations on who can participate. The government has limited resources, so the principal beneficiaries of the 9/11 health program should be the first responders. However, H.R. 847 provides more than just benefits to first responders, but also provides benefits to anyone who lives and works in New York City. Under this bill, even Wall Street millionaires could receive benefits with no cost to them, all done at the taxpayer's expense. In fact, in the Committee on Energy and Commerce, I offered an amendment that was rejected by the committee. I attempted to offer the amendment at rules when this legislation was brought before the House before our adjournment in September, but I was thwarted in that. But it remains that we ought to ensure that federal taxpayers would not have to pay for the health care of millionaires. This bill passed by the Senate, and it is an improvement over what has passed in the House. There could have been further improvements to ensure our limited resources are being spent in the most efficient manner possible, but all in all, the improvements that have been accomplished over the last 24 hours are all to the good. This is an important piece of legislation. This is something that this Congress or some Congress should have passed in the last 8 years, and it is unconscionable that we're here today at the last hour of the 111th Congress with still this work pending. It's important to get this work done. I'll reserve the balance of my time.